This presentation is oral health strategies for the oncology patient. This is an area where we need to improve. There are patients occasionally that I feel are slipping through the cracks here. And what I mean is that there's not proper coordination between the dentist and the physician. The physician may not be knowledgeable, the oncologist may not be knowledgeable of all the dental intricacies and the dental implications of patients under treatment. One of the conferences that I went to recently was a dental oncology, and there was the dentist's name was Dennis Abbott. I have never had more respect almost instantly, like within an hour of meeting a fellow professional than this guy. This was all that he did. This was his specialty. He limited his practice to dental oncology, and I can tell you that there were seasoned professionals in the audience that were in tears. This was brutal. This is a very, very serious area of dentistry where, you know, patients need to be treated with a maximum amount of compassion, and because your ability to eat and to drink and to taste your food is like, when you're going through this entire process, we have to maximize comfort. We cannot underplay this or ignore this. And this particular doctor, this was his calling, and I cannot tell you how much respect I had for him in just that 1 hour of seeing what he did for a living. So let's touch on what the oral health strategy are for these patients, because it's different, it's specialized. We need a better overall coordination with physicians on this, okay? So your primary care physician and oncologist, they need to know the oral consequences of your various treatment. The other thing they need to do is they need to get you to the dentist like immediately. Okay, this is really hard to do because generally this is like shocking news. It's life-changing event. Why do I want to go to the dentist? You want to go to the dentist for a lot of reasons, because, you know, your nutrition and your oral comfort, it's all in play here. Okay, so we want to minimize their side effects from the treatment themselves, and we want to minimize it. Okay, topical anesthetics and analgesics for mouth sores, saliva substitutes. You know, your mouth can dry out from certain treatments, and this has huge implications with decay and gum disease. Okay, all this has to be covered. Okay, and that's why we're talking about integrated treatment. In this whole wellness model, we need to really, really work on integration. Nowhere as more seriously as here. Okay, so for the newly diagnosed patient, you know, they got to get in ASAP. I mean, this is the kind of thing where I have to like clear the schedule and move a patient. This is a priority patient. They got to be in tomorrow. Okay, you know, you want to treat everyone equally, but to me, this is a different classification of patient. Time is of the essence. This is an emergency, so we need to get a heads up on what their current condition is, because their physician and oncologist needs to know that, because this can if you have an oral issue or side effects in the midst of treatment, it can derail your treatment sequence. You have an abscessed tooth in the middle of this and you're having radiation, it's a nightmare. Okay, so we need to know where you're at ahead of time. So we've told the story over and over again how the bacteria can get into the bloodstream, but chemotherapy and radiation therapy, you know, they all have their own individual oral considerations, and so we need to create a treatment plan for that. The oral complications are dependent on what the drug, the dosage, the degree of the dental disease, and radiation. They all come into play, and that's why the oral part has to be evaluated. I hate to say that this isn't done. You know, there are times that this is not done properly. Okay, so patients specifically receiving radiation therapy to the head and neck, there are significant oral implications here. If teeth have to be removed, any teeth that are marginal, it has to be done before treatment. Tooth demineralization and radiation decay is a side effect. that we need to talk about. There can be protective trays with special fluorides and rinses that are used to minimize the side effects of this. That is a giant part of the treatment consideration. And so you're going to need the dentist is a part of this team, ideally, okay? And you may be in to see the dentist every 4 weeks, okay? Because, and hopefully you're on a success pattern, and the dentist is monitoring the fact that, you know, when you pass through this storm, that you don't have permanent long-term damage, and that we can get your mouth back to where your food tastes properly and you're able to eat as soon as possible. Okay, so and we're going to talk about, obviously, nutrition. Nutrition is a huge part of the component during this whole process. So this is another one of those that is very challenging, but to me, like, extremely serious, and dentistry needs to do a significantly better job here.